So basically this is the aorta. Of course, this is the common iliac over here, and the common iliac is then going to be dividing into my internal iliac artery, which is this one over here, and also my external iliac artery, which is going outwards. The external iliac artery doesn't concern me right now. The internal iliac artery is what concerns me. In the internal iliac artery, I'll use the rainbow color again. I have my very important anterior branch, and I have the important but lesser important posterior branch. ये दो internal iliac artery के branches है, that is my anterior branch and posterior branch. You would ask me कि यहाँ पे तो anterior division of hypogastric दिया है. The other name for internal iliac is hypogastric artery. So this is the anterior division that you see over here, and this is the posterior division. So if I want to zoom into this anterior division is one of the most important divisions that I would say in obstetrics. One of the most important vessels in my entire obstetrics. Q, because it gives blood supply to every single pelvic vasculature. वो single कौन से है? एक है मेरा सबसे important uterine artery. ये uterine artery भी देखो कैसे है. जो यूट्राइन आर्टरी ये आ रहा है, एक ब्रांच ऊपर जा रहा है यूट्रस को और दूसरा ब्रांच नीचे आ रहा है. ऊपर जो जाता है उसको हम लाइगेट करते हैं O'Leary's procedure during LSCS if there is too much of bleeding, whereas this descending cervical is that branch that we ligate during Manchester Fothergill repair and also in a few procedures of vaginal hematoma formation. So जो नीचे जा रहा है आर्टरी, इस पे ध्यान रखो, ये आज के डिस्कशन में बहुत इंपॉर्टेंट होने वाला है. Apart from that, you also have your ovarian artery, but ovarian artery is primarily a branch of aortic. So the plexus, that basically a few small branches from the internal iliac go towards the ovarian, but the supply of ovarian is mainly through the aorta. But apart from that, you have your middle rectal artery, you have your vaginal artery, very important in today's discussion, and the most important, we also have a bladder artery, and the most important for today is going to be my Pudendal artery. You see that Pudendal artery over here is a terminal branch. Terminal मतलब इसका end का branch है. So ये end के branch से Pudendal artery से और 3 branches निकलते हैं, और वो 3 branches है. This Pudendal artery gives 3 branches. This 3 branches include the perineal artery. You then have your clitoral artery to supply the clitoris, and you have your inferior rectal artery. So if I'm now going to be talking about ये कैसे आया मेरे पास इतना, I had my aorta, descending aorta, aorta से आया मेरा common iliac, common iliac से आया मेरा internal iliac, internal and external. उसमें से internal से आया मेरा एक posterior branch and anterior branch. ये एंटीरियर ब्रांच में से मेरा आया बहुत सारा वेसल्स, मल्टीपल वेसल्स, बट एक उसमें से जो आज के लिए इंपॉर्टेंट है, दैट वाज माय पुडेंडल आर्टरी. ये पुडेंडल से आए 3 वेसल्स, क्लाइटोरल, पेरिनियल एंड इंफीरियर रेक्टल. आज के डिस्कशन में द मोस्ट इंपॉर्टेंट आर्टरी इज गोइंग टू बी माय पेरिनियल आर्टरी, बिकॉज दैट इज द वन दैट लीड्स टू मोस्ट ऑफ द हेमाटोमास. Another more important arteries I'm going to be talking about, I've already mentioned, are going to be my vaginal and descending uterine. Uterine pura nahi, descending uterine. So these 3 main arteries I'm going to be talking about today. So over here now, if you can see, all these vasculatures बहुत ही ऐसा congested लगता है. I do not believe that this is a very important diagram, but this is a diagram that you should know. You see that you have your pudendal artery over here. This pudendal artery का next जो branch है perineal artery, you can see over here. So this pudendal artery over here, this one, is going and giving rise to multiple arteries that supply your perineum, this entire area. So now you need to know that this is a very important area. And one more thing, I had mentioned that the pudendal artery also the branch called as inferior rectal. You see that over here, the inferior rectal artery is also going. So these branches are going to be the ones which, if damaged, are going to give rise to vulvar hematoma. उसमें भी तुम्हें याद रखना है कि whenever you are giving an episiotomy, your episiotomy can be a left mediolateral or a right mediolateral. In my institute, we give a left mediolateral. In your institute, might be giving a right one. Doesn't matter. The main part is it is a mediolateral one. क्यों? क्योंकि अगर हम लोग सिर्फ medial देंगे, तो directly rectum के अंदर जाएगा. Anal opening, basically anal sphincter injury होगा. So हम लोग medial नहीं देते हैं. We give a mediolateral एपिजियोटोमी. सो मीडियोलैटरल मतलब कौन सा? यहां से हम लोग जाके लेते हैं, यहां तक देते हैं. सो बेसिकली this is my incision, or if you are giving on this side, it can be this way as well. But I'll just show it on one side for now. So when I'm giving a left mediolateral episiotomy, this is going to be my direction. So you need to know which are the muscles that I'm cutting. The muscles that I'm cutting include my superficial transverse perineal and this bulbocavernosus, or rather bulbospongiosus. So two muscles that I'm cutting, it happens to be my bulbospongiosus and my transverse, superficial transverse perineal, two important muscles. If you're going too deep, you can end up injuring more muscles as well. But during my routine episiotomy, these are my two major muscles that I'm cutting, which are again suture back. So episiotomy, most of the injuries that happen or most of the hematomas that happen are because of the vasculature that I just mentioned. It happens to be my perineal and inferior rectal wala vasculature.